Hola, my name is. Hola, my name is. Hola. Hola, my name is.
Hola, my name is the Department of Health and Human Services, Office of Inspector General.
That's the voice of Julie Rivera, Supervisor, Assistant Agent Encargada. And we have Agente Especial, Special Agent in Charge, Omar Perez Aybar. And we have an Undercover Agent for the HHSOIG, the Department of Health and Human Services, Office of the Inspector General. What does this federal agency do exactly?
So our primary focus is to safeguard the programs underneath the Department of Health and Human Services.
Which are?
The primary ones that most people know are Medicare and Medicaid, but also underneath the umbrella, you have the Centers for Disease Control, the Food and Drug Administration, National Institutes of Health, and several others.
Can you define Medicare and Medicaid fraud, and what are the differences?
Sure. So Medicare, because sometimes people confuse it too. So Medicare is a federally funded health insurance program. Primarily, it's for those individuals that are 65 and older, although there are some folks that have some medical conditions that qualify them for Medicare, no matter their age. Medicaid is a state-sponsored health insurance program. It's federally funded with some state funds, but primarily run by state governments.
By the numbers, how many people have been caught up in these type of frauds recently?
So in the last 2 years, unfortunately, about 1,762 individuals have been indicted for committing healthcare fraud.
Not arrested, you're indicted. So when you said individuals, these are health professionals?
This runs the gamut. We have lay persons, but we also have individuals with professional licenses, doctors, pharmacists, nurses, therapists, licensed individuals.
Doctors make good money. What would be the incentive? Why would a doctor get sucked into something like this?
Greed.
To make more money.
Greed. That's it.
That's the bottom line. There's situations where, they may not be seeing the money that they thought they would be seeing, doing it legally. And so they get approached by someone and they give them an incentive. And so they see the money that they can be making and they just take the chance and they go ahead and they start committing fraud.
What's the most popular fraud that we're seeing right now that your department is investigating, and the majority of the cases are what type of fraud?
So right now we're seeing an increase in durable medical equipment, DME fraud, which is basically your wheelchairs, walkers, crutches, prosthetics, and basically people have their identity stolen. The patients have the beneficiaries have their identity stolen, all their information. And then they get billed for these services without even knowing that their number is being used. At the same time, a lot of these doctors don't know that their what's called an NPI number, their number assigned to them, has been compromised. And there's that bad actor, or that individual in the back, who basically marries the two up together and submits it to Medicare, and it gets paid out.
Who's the biggest victim here? Is it our abuelos and our abuelas, or is it? Because this is our money. It's like kind of almost, these people are almost stealing from ourselves and from the taxpayers, right? We pay for these federally funded programs to take care of us and for the health of our seniors when it comes to Medicaid and Medicare.
Sure. Healthcare fraud is not a victimless crime. You just said it. All of us are victims. If you pay taxes, your taxes are going towards paying for Medicare and Medicaid. In fact, if you look at your statement, there's a line item in there for taxes that are being taken out specifically for Medicare.
So if you know somebody that's listening right now, or you yourself is involved in any of these frauds, you're basically stealing from yourself, you're stealing from your neighbor, you're stealing from your government,
your mom, your dad,
your own family.
From everybody.
Yeah.
How can we avoid this? Because we know you can freeze your credit if you've had an identity theft problem and someone is stealing your identity to apply for credit. How can we protect ourselves from one of these frauds involving our healthcare?
So the first thing I would say is, when you get your explanation of benefits mailed to your home, review it, look at it, go through it. You may come across something that was billed by a doctor who you don't know who they are for a piece of equipment or for a service that you didn't receive, and then call and report it to Medicare and say, look, I didn't receive this. And that's important to do, because there's going to come a time, or maybe there won't come a time, but there could come a time where you're going to need crutches, you're going to need wheelchair, you're going to need some type of this equipment. And when they review, when the claim comes in where you officially need this item, Medicare could review it and say, well, we've already sent you 4 of these.
And then you're going to have to track down where did it go. You're going to have to report it. You're going to have to try to track down where that wheelchair went, or where that prosthetic went, or where that brace went, or whatever it was.
And it may be difficult for you to get the actual wheelchair that you need now.
Mm-hmm.
So I'd like to just drive home that point. So in one of the investigations that our office conducted, they went to a beneficiary's home, a patient's home, and they were supposed to have a wheelchair, and they
had a chair.
They came to the door
with a computer chair. It was a case I was investigating.
A computer chair.
Yeah,
with wheels.
¿Cómo así?
And we went to interview the patient, and she approached the door, and she was missing one of her limbs, her left leg, I think it was, and she was wheeling herself around in a computer chair because unfortunately she didn't have a wheelchair because one of these DME companies billed for a wheelchair that she never received. And so the government is not going to send her the wheelchair because in their records it shows that she in fact got one.
And then you get into this situation. Was she honest? Was she dishonest? You'd hate to accuse someone with a disability in your situation, no? But that's what you guys get paid to do, is to investigate these things, and it must be very hard sometimes to figure out and crack the case sometimes who actually did the fraud. Was it that person, or was it somebody else? You wouldn't think that it's somebody that's missing a limb is going to be purposely putting herself in a difficult situation, right, when she has this benefit. Qué feo todo esto. It's very ugly.
Yep.
Very. And very sad because she needed the service and she can't get it now because it was billed by someone. So it's very sad. It could have been my mother, a relative of mine, a grandmother. It's heartbreaking. It's very heartbreaking.
There's a big issue when it comes to kickbacks as well. This is one of the issues that some people might think, oh, pretty cool. I get some money and I can go and participate in this thing, but they don't realize that they might be getting sucked into something that's illegal. Who can how does this kickback thing work?
So basically, whenever you are approached by an individual, whether it be the clinic owner, somebody who works there, even the driver, I'm sure we all drive in South Florida, we see all the different vans of all the different medical centers out there.
They're a dime a dozen.
Right.
And a lot of them are focused on elderly Latinos.
Yes.
Correct. Anytime somebody offers money, and it doesn't have to be cash, it can be any type of incentive. It could be cash, it could be a check, it could be a gift card, $200, $300, $400 a month, whatever that specific clinic is offering, that's illegal. That is where the kickback comes into play. The majority of it is seen in cash because obviously cash is harder to trace. I mean, there have been some instances where we can show that it's a check being written, which makes our case much easier for us to prove, but the majority is written in cash or done in cash, the incentive, the kickback. So anytime you're offered something, an incentive of like this,
red flag.
It's illegal. Red flag, it's illegal, don't do it.
Don't do it. Now, some people do it even though they know they shouldn't do it. And first, let's define it. Cliniqueros. A lot of Latinos fall into this. And it's a joke, just for some people. Oh, la tía de fulano de tal tiene una prima que es cliniquera, o la mamá de Mengano que llegó de Cuba ayer montó una clínica, and look, they just bought a brand new house and they're driving a brand new Maserati, blah, 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 blah. Let's define cliniquero. Who is a cliniquero? What is one of these clínicas that they call?
Basically, anybody who finds, I guess, what they see as an opportunity, it's an oportunista, where they can establish this clinic or purchase this already established clinic and then use it for illegitimate gains or reasons. Someone who is basically billing Medicare through this clinic and receiving millions and millions of dollars for it. I mean, specifically with these DME clinics, I mean, somebody can take and purchase a durable medical equipment company for $80,000, $100,000, an investment, And with the right amount of patient lists and the right amount of individuals working for them to do the billing, can turn a profit of $5-6 million in 6 months.
With no services provided.
None whatsoever.
Incredible.
They don't purchase equipment. They don't really staff anybody in this clinic.
No.
It's
So
just
how
a
difficult
front.
is it for the federal government just to go in and walk into a place and you can figure out what's legit or what's not? No, just by talking to the people that are walking in and out of there? Or is it much more complicated than that?
It can be a little more complicated,
Yeah.
especially now in the era of this pandemic, right? So naturally, the COVID was doing what it did. And so some of these regulations were relaxed precisely because we wanted to ensure, the department wanted to ensure that services were still being rendered, right? It's all about ensuring that patients receive the care that they are expecting. And so as a result, you just had these opportunists who took advantage of those relaxed rules and said, well, this is our opportunity now.
Having said that, a lot of medicine has moved now to telemedicine, where people on their phones or from your laptop, you can talk to a doctor, you can be diagnosed, they can write a prescription for you. What should people look out for there, and is all that they're legit, or what is the biggest scam that's taken place or fraud that's taken place with telemedicine?
I would say that one of the big spikes that we saw during the whole COVID time, or the COVID times that we're in, is a spike in the they're known as community mental health centers, so CMHC, Salud Mental, and there was a time where the services were being done in person at the location, and when COVID hit, there was an approval to do telehealth services. There was a spike and an increase in the amount of mental health clinics that opened up. So if you think about it, we're in the middle of COVID, things are shutting down, mental health clinics are opening up like crazy. And there was a lot of other, lax guidelines that were, I guess, put in place. And it wasn't just on the actual clinic side. I mean, I was talking to financial institutions, to banks, and they were saying, oh yeah, we basically would just open up the bank account. Because, I mean, let's think about it. You really need, for this to work, you need to have a bank account. You need, the whole purpose of doing these types of fraud schemes is to make money, okay? The banks were not going out and doing site visits to make sure that there was an, in fact, brick and mortar location of this mental health clinic or DME clinic or home health agency or whatever it is. So I think it was a multitude of things. An increase in the need for this mental health. Then we had the whole telehealth episode happen. The banks, maybe some were, but some were not doing the due diligence of going ahead and making sure that there was an actual physical location. And then you had the individuals, the patients, because everything's a spoke on a wheel. You need every single one of these to be able to, for this to function. And then you need the patients that sign up and give their information and then get paid the kickback. If you don't have the patients, you're not going to get, you can't bill.
Right.
If you don't have a way for the money to come in, if you don't have a bank account, you can't take the money out. So
Is there a certain group, or is there a certain group of people that these individuals target? Is it black, brown people? Is it white people? Certain age groups?
as long as you have a Medicare and Medicaid card, you're good. I mean, there's no, as long as you have the little gold card for
Right.
Medicaid and the little red, white, and blue card for Medicare,
You're a dollar sign.
you're a dollar sign.
What can, as someone that's listening right now that's maybe involved in a scheme, someone that que está arrepentido, wants out, or someone that has dudas, is kind of scratching their head and saying, wait a minute, I think maybe somebody did order a walker that I never got, and maybe I did see it on a bill, or is concerned that their identity is being used in a illegitimate, illegal way. What would you recommend to these people?
So you have two avenues that we want to share with your audience. And one is you can call 1-800-HHS-TIPS, 1-800-HHS-TIPS, or you can go to our website, oig.hhs.gov. And there's a link in there where you can submit anonymously information that you may want to share with us, maybe even ask your question.
Excellent. 1-800-HHS-TIPS, which is the same as 800-447-8477. That's 800-447-8477, or online, oig.hhs.gov, oig.hhs.gov. Any last message you guys would like to send to anyone who's committing Medicaid fraud or Medicare fraud or is involved in any of these schemes?
If you're committing Medicare, Medicaid fraud, if you're involved in any of these illegal schemes, we're going to come after you. We may not get you today, we may not get you tomorrow, but trust me, we're going to come after you.
Agent Croqueta's coming.
That's it.
He's got a say. I see your handcuffs. You're ready to go.
That's it. That's it.
Thank you so much, Agent Croqueta. Thank you, Omar Perez, ABAR, Agente Especial Encargado, Special Agent in Charge, and Julie Rivera, Supervisor, Assistant Agent in Charge. Thank you very much to our friends at HHSOIG, the Department of Health and Human Services, Office of Inspector General. Why is this so long? Like the FBI is easier. It's like FBI, you know, Department of Homeland Security, a little shorter. You guys are HHSOIG.
OI.
It actually goes further.
It's even longer.
It's even longer.
So
We
it's
left
actually
it at
Department of Health and Human
HHSOIG.
Services, Office of Inspector General,
Office of
Investigations, Miami Regional Office, if you really want to go.
Holy cow. Thank you for
The
the
alphabet police are here.
Do you remember the alphabet? A, B, C, D. I gotta sing it to remember. Thank you so much for everything you guys do. Our friends at the Department of Health and Human Services, Office of Inspector General.
Hola, my name is. Hola, my name is.